Hi class, it's Miss Moran, your instructor, here again to present to you chapter 12 of our step-by-step book, and that chapter deals with anesthesia. So an anesthesiologist is a doctor of medicine specialized in anesthesia and usually works independently. Uh, Probably belongs to a group of anesthesia associates or pain clinic. Their services are reported separately. So the use for anesthesia is to relieve pain, to manage unconscious patients, for life functions. Methods of anesthesia are endotracheal, like you can see here through the mouth, uh, application to an area of an injection of topical agent, that would be a local anesthesia, and the epidural, which is into the epidural space, that's regional field or nerve area, includes the spinal. So we also have patient-controlled analgesia, PCA, where the patient administered a drug and is usually like to treat an acute post-op or chronic pain. Moderate or conscious sedation, the patient controls his own airway and can respond to verbal commands. And it naturally the patient is unconscious, but there's a decrease. He is conscious, but there is a decreased level of consciousness. With general anesthesia, the patient is going to be unconscious, where you can see right over here. So with moderate conscious sedation, the patient is conscious. So with the moderate conscious sedation, we report those codes from the medicine section. Um, Anesthesia codes, which are located in the second section of the CPT book, that's the right after evaluation and management, is anesthesia. And all of those codes begin with the letter 0 for anesthesia. The codes are divided based on the age, less than or greater than 5 years old, time provided by the physician performing the service. Again, these codes right over here, we're talking about conscious sedation. Anesthesia section format. Uh, the anatomic divisions are listed in the anesthesia section of the CPT book, where you can see right over here, upper leg except knee, that's the anatomic site, or lower knee, and the type right over here, hip or the joint or integumentary system. So here we go. The formula is the base units plus the time plus modifiers. B for base unit. That amount, that dollar amount, is published in the RVG that is uh, put out by the American Society of Anesthesiologists. It's a national unit that has a value for anesthesia services, and that value is based on the complexity of the procedure or the anesthesia, and the base unit value the book lists all CPT anesthesia codes. There are italicized comments that are added to the American Society of Anesthesiologists AV. You don't have that book. But this is, for example, what this looks like. The book looks like the relative value guide for a unit. So in other words, for the code, these are anesthesia codes here, all of this here. For 00100, the base unit value is 5. For 00210, the base unit is 11. Anesthesia services are paid on a set amount per unit conversion factor. Medicare unit value for North Carolina in 2019 was $21.62. So T is for time. The patient record indicates time, for example, 15, 30, or 60 minutes. Often 15 minutes is used for 1 unit. So you can see that the unit is in 15-minute increments for time. So 60 minutes, 4 units. So time begins when the anesthesiologist begins to manage the patient in the operating room or in the pre-op, and continues throughout the procedure, which is intraoperative, and ends when the patient is no longer under the care of the anesthesiologist, which is post-op. Anesthesia time started at 9 a.m. Patient discharged to the PACU at 1:30, so that would be 270 minutes. PACU is post-acute care unit. M for modifying unit. Physician condition indicated by physical status. I'm sorry, the physical condition of the patient is indicated by a status modifier. The modifiers are P1 to P6, and you'll find those at the beginning of your anesthesia section in your CPT book in the green pages. The risk factors taken into consideration as well. Physical status modifiers, P1 is a normal healthy patient, all the way to P4, which is a severe systemic disease and in constant threat to life, and P5 is not expected to survive without an operation. So you can see the severity from P1 to P5 of the patient's status. And these are called physical status modifiers. P6, dead. Physical status modifiers, the payment differential based on some physical ratings. Another modifying unit is qualifying circumstances, and those are 99100 to 99140, and located again in your green pages of the anesthesia section in the CPT and also in the medical. So here we go, qualifying circumstances, codes, and relative value. So right over here for 99, as you can see, it's an add-on code. There's a little plus there. So remember that you cannot use this code ever alone, and it's never listed first. So anesthesia for patient of extreme age, younger than 1 year and older than 70. So base value would be 1, and so on. So the formula again is the base units from the RVG based on the CPT code, and the time often in 15-minute increments, and you're modifying circumstances and our physical status modifiers. B plus T plus M. And then, so B plus T plus M will be the total units, and those units will be multiplied by the conversion factor, which is going to be different in different areas of the United States. The conversion factor, we'll see further here what it looks like. For example, in North Dakota, it's $21.65. In Manhattan, $24.65. And that number, these numbers are based on locality, like you can see, because it's more expensive to practice medicine in certain areas of the United States than in other areas. So these are the anesthesia conversion factors. Anesthesia for multiple surgical procedures. Once anesthetized, the length of the time is not the number of procedures. Again, the length of time is not the number of procedures. Multiple service, example, 2 procedures during the same session. One is a 10 base unit value and the other is 5 base unit value. You're going to report only the 10. HCPCS modifiers, you'll find those in your HCPCS coding book. That's the smaller one with the spirals. They're added to the anesthesia codes. Now remember, those anesthesia codes all begin with a 0. So AA is anesthesia by anesthesiologist. AD, physician, medical supervision of 4 or more concurrent procedures. G8, monitored anesthesia care, complex procedure. G9, patient history of severe cardiopulmonary condition. And QK, qualified individual, medical direction of 2, 3, 4 concurrent cases. So qualified individual would be like, for example, a CRNA, certified registered nurse anesthetist, and who the anesthesiologist oversees. Here you go, right over here, QX CRNA, directed by the physician. And the physician, again, is going to be the anesthesiologist who is overseeing. QY, anesthesiologist directing 1 CRNA. QZ, without direction. Now, I've had this already. When I had a colonoscopy, I had a CRNA that gave me my anesthesia, and there was maybe the direction of my gastroenterologist, but there was no anesthesiologist there. So that's the conclusion of anesthesia, chapter 12 in our step-by-step. Talk to you soon.